Aspirin, also known as acetyl salicylic acid, is a non-steroidal anti-inflammatory drug widely used today for its analgesic effects. Alternatives to aspirin include other pain relievers such as acetaminophen, which relieves pain by directly affecting nerves, unlike aspirin and other NSAIDs that control prostaglandin levels. COX-2 inhibitors, which target the COX-2 enzyme responsible for inflammation and pain in arthritic joints. And corticosteroids, which work by inhibiting an enzyme called phospholipase A2.
What are the pros of aspirin? Aspirin relieves pain by targeting pain-causing prostaglandins. It reduces the severity of a fever. It thins the blood, reducing the risk of a heart attack. This also helps prevent strokes from occurring.
Aspirin can have numerous side effects such as damage to the gastrointestinal tract. This can include abdominal discomfort, nausea, and vomiting, as well as more harmful gastrointestinal effects such as hemorrhaging and peptic ulcer disease. CNS effects include dizziness, headaches, and tinnitus, also known as ringing of the ears. Renal failure is also of concern.
The first mechanism of action of aspirin is to inhibit prostaglandins. This also reduces inflammation and pain.
When cells are damaged, they release a chemical called arachidonic acid. Prostaglandins are formed when arachidonic acid reacts with COX-1 or COX-2. Prostaglandins cause us to feel pain, cause our body temperature to rise, and cause inflammation in affected areas. Aspirin enters the body and interrupts the production of prostaglandins. It does this by stealing arachidonic acid's place, and so it blocks COX-1 and COX-2. This effectively barricades the COX active site and blocks the synthesis of prostaglandin. Aspirin's acetyl group attaches to serine 530. This blocks the channel, and arachidonic acid, the precursor to prostaglandin, can no longer reach the COX-2 catalytic site. Inhibition of prostaglandin synthesis in the gastrointestinal tract causes increased gastric acid secretion, diminished bicarbonate secretion, diminished mucus secretion, and this all leads to increased gastrointestinal damage.
Aspirin's second mechanism of action is to inhibit platelets. This reduces clotting.
Platelets are fragments of megakaryocytes that cause red blood cells to clot.
Cyclooxygenase enzyme converts arachidonic acid to thromboxane. Thromboxane A2 stimulates platelet activation and plugs the bleeding area. Aspirin inhibits the action of platelet aggregation by inhibiting the COX enzyme. This will reduce blood clots and make the blood thinner. It is the reason why aspirin is helpful to prevent heart attack and stroke. The following risk factors will all contribute to an increased risk of adverse gastrointestinal effects such as bleeding and peptic ulcer disease, and should all be considered prior to the prescription of aspirin. Men aged above 45 and women aged above 55, aspirin taken in high dosage. If the patient has a prior history of gastrointestinal bleeding, Helicobacter pylori infection, peptic ulcer disease, and if aspirin is used in conjunction with other NSAIDs or anticoagulants.